Today, our guest is Dr. V.Mohan. Dr. V.Mohan is an internationally renowned Indian diabetologist. He is the chairman and the chief of diabetology at Dr. Mohan Diabetes Specialist Center, a WHO collaborative center for non-communicable disease prevention and control, and an IDF center of education. Dr. Mohan is also president and director of Madras Diabetes Research Foundation. He worked at the Royal Postgraduate Medical College, London, as a Wellcome Research Fellow, and at the Alexander Von Humboldt Fellow at the University of Ulm, West Germany. He has over 1,200 publications in peer-reviewed journals like Lancet, British Medical Journal, Journal of Clinical Endocrinology and Metabolism, Diabetes Medicine, Diabetes Research, and Clinical Practice. Dr. Mohan was awarded the Padma Shri, fourth highest civilian award in the Republic of India. So today, please help me to welcome Dr. V. Mohan. So Dr. Mohan, you are a long-time practitioner in diabetes area, right? And you are also Padma Shri. In 2012, you received that?
2012, yes, that's correct.
And I have heard you have received a series of awards. You want to talk about that something?
Okay. So, I have been blessed, to have had as my father a very famous person, Professor M. Vishwanathan. He's considered like a legend in India because he started the first diabetic clinic in India.
Yeah.
And so he's often referred to as the father of diabetes in India. So having started that, after about 25 years, he had to start something on his own. And I was his eldest son. So he invited me to join him. And so at the age of 18, I had the good fortune to join him and to start really working on diabetes itself, which I don't think many people in the world would have had that opportunity. So I had the good opportunity. I made best use of it. And therefore, right from a young age, success started coming to me. And then now, of course, I'm fairly well established. I run a very large diabetes center as well as a research center. We publish extensively. So a lot of awards have come. You mentioned the Padma Shri, but also the Dr. B.C. Roy Award, which is one of the highest in India for a medical doctor. I got that many years ago. And then I got the Dr. B.R. Ambedkar Award, which is considered the highest research award in India, given by the Indian Council of Medical Research. And one more noteworthy is the Dr. Harold Rifkin Award. This is given by the American Diabetic Association, and I got it 2 years ago. And I was the first Indian to get it. It's given for distinguished service in the field of diabetes to any only one award they give every year. And 2 years ago, I became the first Indian to get that award.
So. What an honorable moment for us. It's a really proud moment. So I also heard that you have written 1,300 papers?
Yes.
Like research papers?
Yes. That is also a world record by a practicing doctor. There may be a few people who are in full-time research, for example, working in Harvard or working somewhere where they don't do anything else, just research. And also they have the opportunity to collaborate with the whole world. If you work in Canada, US, and so on, you have the opportunity to work full-time and to collaborate with the whole world because they have so much of technology there. So there could be a few who are ahead of me, but somebody who's practicing medicine, actually seeing patients almost on a daily basis, and then to publish 1,300 research papers with very high impact, I don't think I have seen anyone who has achieved that. So I believe that is a world record. So.
Sure. So in healthcare, it's an $8 trillion industry, isn't it? It's one of the largest industry, and it is growing. And health is gonna be a really biggest problem, right? And people are actually, especially seeing the COVID like this, and there are a lot of other pandemic. People are actually predicting where the industry, gone wrong in all this. What's your opinion? Why this situation is happening? Like more people are getting sick. If you may want to say something about it.
I won't say the industry has gone wrong in doing anything, because every 100, 200 years or so, some kind of a pandemic occurs. We have seen this many, many years ago, 200, 400 years ago with the plague. Suddenly plague comes and people just die. In those days, there was no treatment for plague.
Yeah.
100 years ago, exactly 100 and flu came.
Yeah.
And the Spanish flu killed millions of people. It just spreads like once this kind of a virus, fairly, dangerous and fast spreading virus comes, you just can't stop it. And it kind of goes all over, and everybody is, getting affected. 40%, 50% of the population can get affected.
Yeah.
So COVID-19, we really don't know how it started, but definitely seems to be from one city, Wuhan in China.
Yeah.
But there are some evidences that even before that, something might have been around. I was recently reading about an English team which had toured South Africa in December. That's about 2 months before the Chinese thing was announced. And at that time, everybody developed what they called was a flu. And the whole, tour was kind of affected by that. There were no people to play on the field, and they all became quite sick. I wonder whether that was COVID now. And so this is a kind of a pandemic, which once it starts spreading, it's almost impossible to stop it. And all governments did their best. If you see the Indian government, what all they did, first of all, they blocked all the borders. They said nobody coming in, everybody coming in will be screened. And you'll think that this is all being, simply they're saying. It's not so. I know exactly every single person who arrived into India because India didn't have it, obviously. It came from somewhere from abroad. Yeah. And every single plane, any other mode by which people came in, they were quarantined. There were health officials going after them. They were being asked about their symptoms. Who all they possible it was done. Interstate borders were all closed, so you could not go from one state to another. There were massive programs. Every time you pick up the phone and make a phone call, there is a message in your state, whatever language there is, 23, 25 languages, they say, watch out.
We have a bit of trouble.
Despite that, it starts spreading, because a pandemic is very difficult to stop. Now they're saying it's even airborne. So with that kind of a thing, see, every country has certain beds, hospital beds available. Let's take Sydney, or let's take Chennai, where I am. And let's say the total number of all beds put together is 100,000 beds. I'm just making up a number. Now, suppose 500,000 people fall sick. Now, what do? All the beds are full. There's nothing that can be done. Luckily, that kind of a situation only came in Spain, Italy, and one or two places. China very quickly ramped up, and we really don't know what happens in China fully. So we don't know. But we know that the next countries which are affected were Italy and Spain, and they didn't take it seriously. In fact, I was very lucky, because 2 weeks before Spain, March 1st or so in Spain, it started. In middle of February, I was there. Nobody knew. I was in Madrid. Nobody knew about this. I was also happily going about. And then I was considering myself so lucky. Point. Then it becomes very difficult. And then the other thing is that, see, each hospital is geared for certain work. What do we know about COVID? What does anybody know about COVID? The thing is that such a new disease, nobody knows what it is. Every day some new symptoms are coming. Today I saw in the paper, after COVID, after 1 month, 3 months after COVID, you're still having strange symptoms not related to cough or not related to breathlessness or the lung. You can have nerve problem, neuro problem, this problem, that problem, kidney problem, diabetes, all coming due to COVID. So first of all, it's a new disease. Number two, we don't know anything about it. Number three, we don't have a vaccine for it. It's still coming. Number four is that the numbers spread too rapidly, and any health system can get overwhelmed. That is why every government which tried to lock down, what they're trying to do is, as they said, flatten the curve. So instead of the numbers going up so much that every hospital gets overwhelmed, can we kind of slow it down so that at any time they're able to have enough beds to manage? So the industry has responded, I would say, quite fast, because never in the history of any illness, viral or bacterial or anything, has a vaccine been produced so fast. Not just one, but like 10 candidates of vaccines. From China, we have a Korea, we have Russian, we have US, we have Indian vaccine coming. So many varieties of vaccines are coming. Now, to get a vaccine trial done, again, you can try to shorten the time incubation from 3-4 months. So the first viral thing actually started in January, maybe in China, but it's going to the rest of the world only in March. And here we are in August, already having so many vaccines which have been produced. So I think people have worked with remarkable speed. It's kind of marvel how they have done this. And I'm quite confident that by November, December, a vaccine will be out. They could never do this with SARS or MERS or any of the other viruses. But we have learned from all of those, and hence they have done this. The other good thing which was done, where the industry rapidly responded and the government also helped, was telemedicine. For example, you take India, telemedicine is illegal in India. So suppose somebody calls me on my phone and I give a consultation, even out of humanitarian grounds, it's actually illegal. You can't do that. But on 25th of March, they opened up. They said anything is possible. WhatsApp, email, telephone, anything you can do a consultation. Now, having done that, even through Zoom or whatever you want. So having done that, now it's very easy for people to reach out. And all this would have came only because of COVID. So I would say we have not actually failed, but we're taken by surprise. And because we're taken by surprise, nobody could react in the proper way. And the other thing is, there's no one answer. People don't even know how to see. We have to test it, first of all. To test it, there are no kits. You have to have an antigen test. You have an antibody test. With the antigen, the rapid tests were all wrong in the first instance. Then they had to very rapidly produce. Now, unless you test and you prove it's COVID, there are many symptoms which can mimic COVID. For example, ordinary flu, cough, fever, sore throat, body pain, all this can be an ordinary flu. So how do you know it's an ordinary flu or a COVID? Okay. For that, you need a proper test. Now, how do you get the test? Only after this came, suddenly it came. So then they have to start making the kits and so on. But today, we have kits which are fairly reliable. Antibody test, which will tell you whether you had the infection. All these have now come. So I think it will be unfair to say that, the medical community or pharmaceutical industry failed in that. They have done their best and quite rapidly they have responded. But everything takes time because we are dealing with human beings.
No, they've done a tremendous job, and the people are working hard. Government is working hard, for sure. And I'm pretty sure in the past when these things happens, the world was not so actually accessible to every community.
Absolutely.
So that was one reason to spread, I believe so. And now, even though closing the border was too late by the time people get to know. So I'm also hearing it is quite effective to the diabetic patient. So how you are actually trying to help to the people in this current situation from your trade actually?
So if you look at the outcomes of COVID, first of all, before that, I just want to answer and support what you just said. See, even if you don't have to go back to Spanish flu, which was 102 years ago. You don't have to go there. That's a different, world's population was less than 1/5 of what we had at 100 years ago. So forget about that. There was absolutely no way of communicating at that time. Radio or something might have been there. But what do you get? How far does radio reach? So nobody knew what's happening during that epidemic. You don't have to go that far. Just go back 10 years. 10 years back, if you go back, that's where the SARS and the MERS epidemics came. One came Middle East is called MERS, and SARS came from Southeast Asia and so on. When these two came also, of course, they were not as widespread as COVID. That's number one. But number two is, social media was not that much developed 10 years ago. You won't imagine that 10 years ago, social media, where was WhatsApp 10 years ago? So there's no WhatsApp even 10 years ago. So now what happened? forwarding pictures. Somebody from Spain will say, oh, we are flooded here with patients. We are putting them all on the floor and people are dying like flies. And somebody, whether it's true or not, we don't know. Even if it is true, if it had happened before WhatsApp, only in Spain it would have been there. Nobody would have known. Now what happens? The whole thing is spread all over the world. Oh, we are also going to die. We are also going to die. We are also going to die. Everybody is forwarding. And then fear complex, panic sets in,
Yeah.
So that is what has made this much worse. False, fake news, and all kinds of wrong information, panic being spread, and so on. Negative news, basically.
Yeah. And it's like that's the biggest challenge in the current digital era, where people are actually struggling to control the proper news. Like what is fake news is actually spreading more faster than the actual news, and it's become a challenge for the cybersecurity issues and other sorts of issues in social context. It is occurring right now. But
so, getting back to your question about diabetes, I didn't answer that. Why am I interested as a diabetologist in COVID-19 and in diabetes in general? Now, if you look at the worst outcomes that occur in COVID, so see, if you see 80% of people with COVID are asymptomatic. They don't even know they have it. It's very difficult to diagnose.
Yeah, for sure.
20% have little more symptoms. Out of that 20%, about half of them, about 10% of the total, get little more severe and they need to get into hospital. 5% get into ICU, and about 1% to 2% may die. Out of the entire numbers, maybe about 1% will die.
Yeah.
Now, if you look at those who get into the ICU, those who get into hospital, and especially those who die, there is a predominance of certain non-communicable diseases in these people. First of all, they're older people. Age is a factor. Second is diabetes. Third is heart disease. Fourth is blood pressure, high blood pressure. Fifth is some respiratory disease, asthma, and so on. So people who have all these comorbidities, as we call them, they are the ones who seem to die. So from my point of view as a diabetologist, I tell all my patients, you better control your diabetes well and make yourself like a non-diabetic person. Then your risk if you get COVID is like the other person. It will come, some cough, cold, 3 days, you're cured, gone, like an ordinary flu. If you don't control your diabetes, what happens is that when this COVID gets into the body, it spreads. The whole immunity is very low, therefore it can very easily spread. It's like as if your immunity has gone to sleep and there is an invader attacking when you're sleeping, So fight the invader better. But if the whole army is sleeping and at that time the invader comes, you can imagine what will happen. The whole country will be taken over. So like that, the whole body is then taken over by the virus. It will start producing all kinds of bad, cytokines and so on. It's called cytokine storm. And that goes and damages the kidney, the heart, the liver, all the organs, the lungs, pancreas. And that produces all the problems. That becomes more in people with diabetes, obesity, heart disease, smokers, those who have chronic respiratory disease, asthma. These are the people, or cancers. These are the people. So they are the people who tend to die. So in my specialty, we have been focusing on trying to keep the sugars under good control and seeing that we protect people from getting into bad outcomes.
Yeah. And how this is actually affecting your non-communicable diseases? Like what's happening in that area?
Yeah. It's very important question that you've asked, because what happens, and I wrote actually an open page in the Hindu, I think the last Sunday, not the Sunday, the previous Sunday, I wrote an article in the Hindu, in the open page, our national paper, where I said, non-communicable diseases, are they getting sidelined by COVID? Now, what happens is, when everybody starts thinking only about COVID, we go on and on and on. What we don't realize is that, like any pandemic, the Spanish flu lasted 1 year to 1.5 years. SARS, MERS lasted about 1.5 years. Now, this is about 6 months to 9 months, 6 months, 7 months now. I expect another 6 months, COVID will go away, just like SARS, MERS, and all. Because many people will die, unfortunately. But another 6 months, you're not going to have COVID forever. Next 20 years, you're not going to have COVID. It's an infection. Once it infects a significant number of people, it will go away. But there are diseases like diabetes, heart disease, hypertension, cancers, all these, which are permanently there. They are not going to go away. First of all, they'll make COVID worse. But then these diseases are the real killers. If you take the whole world, number of people who have died due to COVID, that many people die every week due to diabetes. Okay. So these are much bigger killers. And so my plea to the government was, and to everyone was, yes, take COVID seriously, take all the precautions you can, but don't neglect diabetes, hypertension, heart disease, and the other killers, because these are going to stay. And if you lose time now, you will not be able to gain. In fact, there's another very interesting article I read today in the papers, and that's been circulating now, saying that by wearing a mask, you're not just going to prevent COVID. If everybody wears a mask, TB can be eliminated, because tuberculosis is spread through cough, and by coughing, and somebody else picks up the TB germ and then gets in.
Yeah.
If you wear a mask, not only COVID, you can prevent TB, and TB kills 100 times more people than COVID in India.
Third world country, especially in India.
Exactly, especially in
India. In Australia, luckily prevented
so
a lot, but a lot of developed countries actually prevented that problem. But yeah, third world countries are still struggling, unfortunately. Yeah.
Correct.
Yeah. So having said that, right, it's of course it's a hard time. So in terms of business, when it comes to your business, I heard you have 48 branches or something all over India. Yes.
In 8 states of India and about 32 cities in India.
Wow. And it's grown in last 20 to 30 years.
Yes, about 29 years now, yeah.
Right. And right now it's like, and also I have heard that you are doing a lot of charitable work and helping a lot of people who can't afford the medication of diabetes. Yeah, that's what you are doing.
That also we do, because from the beginning, my wife and I started off on our own, left my father's center and started. So the first day itself, we hardly had any patients, but we said, let's start doing some charity right now. Let's not say after 20 years when you earn something, we will do, because we won't feel like doing at that time. We'll want to make more money. So we said, let's keep a small portion of our earnings right from the first day to charity. And the principle is this, that, we from society only we have grown. So back to that society, if you give something back, then that's, it's a very soul fulfilling thing, and you feel that you get satisfaction. How much ever money you make, you don't get satisfied. We treat one poor patient, the kind of satisfaction we get is very good. Over and above that, now I'm a devotee of Bhagavan Satya Sai Baba. And I am now a member of the Central Trust, which runs his entire organization. The fundamental principle in Bhagavan Baba's organizations, whether it's hospitals, colleges, anything which he runs, it has to be free. When I say free, not even 1 rupee can be collected, not even a registration fee can be collected.
Yeah, I heard that.
So from that, so his philosophy is love all, serve all, help ever, hurt never. So he has kind of ingrained that in us, that unless he says nothing wrong in running an industry. You can run an industry, you run your hospital, you have to pay salaries, you make your don't everything. Becoming rich is not nowhere in Bhagavad Gita it said remain poor, don't become rich. They only said help others, love all, serve all. That's all it said. So all he says is, can you do one clinic for someone, who really cannot afford? That will give you, and when you do that, he says, don't look at it as if I am a rich fellow, you are a poor fellow, come take this and go. Not like that. It's an opportunity for us to serve. It's a real opportunity. You are giving me, and so thank you for giving me the opportunity to serve. So that is how he has taught us. So that way, we run 4 or 5 free diabetic clinics, 2 with the Satya Sai organization itself, others on our own, including a big rural unit we are running. And they're all giving us a lot of satisfaction.
Yeah. Hats off to you. I mean, there are a lot of people require that. And of course, there's like, when it comes to the serving, it has to be selfless, and that's the part of philanthropy, which is really great. It's admirable what you are doing in that area. So, you have actually dedicated your life for, on this mission, like you want to help people. And I heard you started at the age of 18 and you are still working on it. So what's your insight approach, and why did you take this kind of approach where you gone, multiple places and open up so many branches, and what was the motive behind it?
So the point is this, that diabetes is a lifelong condition. Suppose you're running an eye hospital. People come to me for a surgery, they finish surgery, they go away. They don't have to see me again. Suppose I'm a gynecologist or obstetrician, deliver a baby, baby is gone, mother is gone, and I don't have to see the mother or the baby again unless she gets pregnant again. But this is not like that. Diabetes is very different in the sense that they have to keep coming back again and again and again and again. A minimum 3 to 4 times a year, we have to see them. So what we started finding is, as our clinic became more famous, we started getting people from Calcutta, from Northeast, from Dubai, from here, from there, from all over the place, people started coming. Now, if you tell them come back 3 times a year, 4 times a year, how can they come all the way to Chennai? So we started, even with Chennai itself is very big. So we first started with one branch in Chennai, in another part of Chennai. That worked very well. Then we said, let's try one in the city of Hyderabad to see whether, we are leaving the state and going and whether it will work. That worked very well. So we said, okay, all you need is to train people. So I started training doctors, I started training dietitians, started training ophthalmologists, training everyone, created a whole ecosystem. So with that, now with the entire training, with SOPs given, with ISO 9000 certification, with TQM, Total Quality Management, all these systems built in, we were now able to replicate the system. So it's something like, opening up, KFC or McDonald's, the same systems are followed. So if you have a burger in New York or in Sydney, you may not find the difference because exactly same method, same everything. So that in healthcare, we try to do. And our specialty, it's possible because we do it with numbers. What's your sugar? What's your blood pressure? What is your cholesterol? What is this? What is that? And there are algorithms which you can develop. You can't do it, for example, a cardiac surgeon can't do that. How can you go and he has to, with his fingers and with his brain and his thing only hands, he can operate. He cannot operate from here in Hyderabad and somewhere. He can train people, of course, but it's more difficult in a surgical skill. It's your own own skill which matters. Here you can develop systems and say you do this. If so much, you do this. If so much, you do this. If it's not this, you do this. So like this, we develop systems. It took some years to develop. Having developed it, now we find that we're able to serve much more people. See, suppose I had remained as a single practitioner. Okay, I could have made equal amount of money even as a single practitioner. But how many patients I could have seen with quality time given to them? Maybe 20 in a day. If I'm extremely busy, if I work from morning to night and I tire myself out, maybe I can see 40 patients or 50 patients. Beyond that, we cannot see. At one time, before this COVID came, we were seeing 1,300 patients. So this came because I have more than 100 doctors working for me. So even each one sees 15 patients. We have still got so many 1,500 patients we can see. So that is the thing we're able to. And then the other thing is somebody comes from Calcutta or from Guwahati to see me, or from Lucknow to see me. In fact, we had a branch in Lucknow, so which didn't work out quite well. And just before COVID, we had closed that. But all over India, we're planning to do, because then if the patient comes even to Chennai, we can say go back and see our branch there and finish 3-4 visits there. Maybe 1 or 2 years you can follow up with that branch. And everything is connected through, because you talked about digital health, everything is connected through digital field. So if they have their records there, I can easily see it here, even if they want me to see it. Similarly, they come here, it will go to that branch. So follow-up becomes very easy. Nobody has attempted it in this scale, but slowly, we did it. And today we are able to serve so many people. And then we are on WhatsApp groups of all our consultants will be in one group. Email also we have, WhatsApp. So suppose we have an interesting case, I'll post it in that and say, look, today I had this thing. This is what we're going to do. For COVID, this is what we're going to do. So immediately everybody is refreshed. And then, of course, I also take classes for them and so on to maintain the quality. Then, of course, audits become very important. That is why we went for NABH, NABL, CAP certification, ISO certification. All these we went for so that the quality is maintained in a very nice manner.
Very good. So it's like more of a, I always embrace some kind of a system. Like without system, without process, without strategy, it's very hard to achieve the success, especially on the scale you are achieving for sure. And these days, it's like it really commends well that you are actually embracing the technology in such a scale. If almost everybody will start using it, life will be much easier, especially if you want to grow. So I'm a big fan of that. Anyway, I'm from the technology background, so it's my always positive side on that. You see doctors in the more of they should also embrace more a humanitarian side, like people should come and do something more on that area. Do you see any need on that?
So one of the big training that we give to our doctors, of course, I teach them medicine. So I teach them medicine, I teach them the art of treating diabetic patients, all that I treat. But all my doctors work with me for 2 years. Full time, they work with me 2 years. So during that time, I take them on these camps, the free diabetic clinics. I make them do that also. We don't pay them anything when they go for the free. I'll say, that's your seva. That's what you're going to do. So we take them. So they see the other side of the life, and they know that we're not doing this for show. We're not doing this just to say we treated so many free and get some name award. But we are actually doing seva. And then I tell them, when you go for that seva also, you must spend it, do it with love. Because that is very important. It's not just, I went and saw some. Said no. You'll have to really spend. So once we inculcate that, I get 2 years to do this. So at the end of 2 years, they also develop the same culture. And then integrity and ethics is very important. So I tell them, don't cut corners. Of course, as a business, we want to make it profitable, but never ever cheat your patient, because we didn't come into the profession to cheat. We could have been in any other profession if we wanted to make money. Why did we come here? Because it's a noble profession. And therefore, full trust the patient must have in us. And if they trust us and they come, if we breach that trust, finished. They will never come back again to us, and they'll stop trusting you. I said, that alone you cannot change. So you must do what is good for the patient all the time. Do only what is correct and ethical. Even if I tell you to do something unethical, refuse and say, don't do that. Because you'll say, you taught me to be ethical, so I will not do that. So these principles we have, brought in, and that is what has given a good name to the organization. And then, of course, we maintain very high quality and very detailed we go into the disease, which people, of course, immediately find out when they come for a treatment, the depth to which we go.
Yeah. Would you like to give any advice to the people who want to do the similar thing in this area? Someone want to?
I would say that for those who are in the medical profession, whether it is medicine, dentistry, pharmacy, nursing, pharmaceutical, physiotherapy, anything, you're serving human beings and you're dealing with human lives. I would say excel, become the best in whatever you do, create a niche area for yourself, become world class, build big institutions and make it successful, and be profitable also, because without profit you'll close down. Have that also, but always have ethics as number one, integrity as number two, and number three, a humane heart, a humanitarian approach, empathize with people. Because ultimately, at the end of the day, they need our sympathy, empathy, love. That is very important, because this profession is very different. Some other profession, you can say cash down or go. That's it. Here, of course, it's cash down. We don't mean that. But then there are always ways in which we can help them out, treat them kindly. Once you do that, then you leave a mark in this world, and your life would have been more meaningful. And of course, in the process, you earn the goodwill of people. So therefore, you will grow. People will support you. People will come back to you. They trust you. They will never leave you. They can never leave you. As long as you're alive, they'll want only you, and they'll want only to come back to you. To build that trust, it takes a long time. To lose the trust, it takes only 1 day. 1 minute, you can lose the entire trust. So keep that in mind. And then, like diabetes, there may be many other areas. But you have to have and then you have to have a good team, because you must trust your team. Without your team, you cannot do everything yourself. You think everything you're going to do, only a certain amount you can do. If you cannot delegate and bring in a lot of people, then sky is the limit. You can definitely grow and make.
Interesting. So people want to find you. How can they find you?
I think if they Google me, they can find me. But then if they just, if you can add my email ID at the end of this program, drmohans@diabetes.ind.in. That's my direct email ID to me. So if they write to me, I always respond immediately.
Sure.
So let them write to me. Let them also look up. I am on social media. If they just write D-R-V-M-O-H-A-N, Dr. V.Mohan, they'll find me on social media. And of course, if they write Dr. Mohan's Diabetes Specialty Center, then my hospital's social media, we are on all the social media, both in the hospital as well as mine. And there are a lot of things. If you visit our website, www.drmohans.com, www.drmohans.com. If you just put that, you have articles, blogs, so much of information. We're trying to give out resources, reading material, everything free to people. So whoever is interested to learn, they can visit our website, visit our thing, subscribe to our channel, and then they can get a lot of information. And anything more they wish to clarify, we are just an email away.
Thank you. So I'll put all the details down there in my comment, and everybody can reach to you whenever they want. And thank you for sharing your valuable journey with us and the achievements you have done. It's really, really, hats off to you for that. We really admire you. Thank you so much.
Thank you, Priya. Thank you so much. Wish you all the best.
Thank you.
Bye-bye.